Can you have PTSD only when you're actively having symptoms of PTSD? Or can you have PTSD that's kind of on the inside? You know, that you're just suppressing memories, you're suppressing things that happened in the past, and it's affecting you, but it's really not what you would say is PTSD. And the answer to that is that really there's two subtypes of PTSD. There's kind of what we commonly think of PTSD, where you're having symptoms. So that means that you're having flashbacks, nightmares, you feel really scared. It's pretty overt. You're avoiding things, you're really jumpy, you're irritable, those kind of things. And that's what you kind of say is more the classic symptoms of PTSD. What happens many times, if not most times, when people experience a traumatic event, especially in the military, is that people die. So it's not only that you get traumatized by the experience, but you also experience a permanent loss, like the death of somebody, a death of a pet, a death of a loved one, things that are never going to come back. And when you experience those kind of things, you develop what's called traumatic grief. That's a term that people haven't used much, but it really describes it. That you're grieving, you're trying to get over the loss, but you also were traumatized in the experience. And a common way that people deal with it is, in a sense, by not dealing with it. They push it down. I mean, it's really awful. You're a child who lost a parent at a young age. What are you supposed to do? You suppress it. You know, you had other awful things happen to you when you were little. So how do you keep functioning? You suppress it. So the way that manifests is that these people generally don't have so many overt symptoms of flashbacks or nightmares. They tend to be avoidant. They don't really know why they're avoidant, but it really comes out with their emotional distancing. They just can't be close to anybody. They become almost paranoid. They don't trust people. They don't trust themselves. They tend to have low self-esteem. And so what happens is that they become almost like a shell of a person. They live in their head. And it's really, really debilitating. In a sense, it's not what you always think about PTSD, but it's just as functionally impairing. The good news, though, is that you can treat it. But once again, the challenge is you've got to identify these people.